Hello everyone. Here we'll try to learn how to determine erythrocyte sedimentation rate. So, aim of this experiment is to determine erythrocyte sedimentation rate. So it is the rate at which erythrocytes settle down. So it can be done by two methods. One is Western Green's method and another one is Wintrobe's method. For Western Greens, the apparatus which are required are the Western Greens tube. It is a straight glass tube 300 mm in length and 2.5 mm in diameter. A scale graduated in mm extends from 0 to 200 mm along the lower two-thirds of the length. The graduated volume of the pipette is 1 ml. Then we require Western rack. This is a special rack to hold Western Green's pipette in a vertical position. It is constructed in such a way that the rubber stopper attached to the springs close the open ends of the tubes when they are placed in rack. So anticoagulant used here is 3.8% sodium citrate solution. The ratio of blood to the anticoagulant is should be 4:1. Then procedure with aseptic precaution, collect the venous blood using sodium citrate as an anticoagulant. Suck the blood slowly in the Westergreen's tube up to the 0 mark. Keeping the finger on the upper end, the lower end of the tube is placed on the rubber cushion of the stand. Release the finger and fix the tube with screw cap. Keep the tube in the rack undisturbed for 1 hour. Read the height of the clear plasma at the end of first hour and express the results as so many millimeters at the end of first hour. The rate at which erythrocytes settle down under standard condition is called as erythrocyte sedimentation rate. The normal value in male is 1 to 5 mm at the end of 1 hour. In females, it is more, that is 5 to 10 millimeters at the end of 1 hour. By Wintrobe's method, the apparatus required are the Wintrobe's tube, which is a straight thick wall tube 11 cm in length and an internal bore of 3 mm. The tube is graduated in mm in both the directions from 0 to 10 centimeters. The marking from 0 to 10 from above downwards is used for reading ESR. Then we require syringe spirit swabs. Then we require Pasteur pipette. This is the pipette with the long neck used filling the Wintrobe's tube. So these are the diagrams showing the estimation of the ESR with the Western Green tube method and by Wintrobe's tube. Okay, so here you can see the Western Green pipette in the Western Green rack. And here the Wintrobe's tube is shown in a vertical direction. And here you can see this is the clear plasma, which is nothing but the erythrosedimentation rate at the end of the first hour. So similarly in the Wintrobe's tube. So in Wintrobe's tube, with the usual aseptic precaution, collect the venous blood using double oxalate as an anticoagulant. Using Pasteur pipette, fill the Wintrobe tube with oxalated blood up to the mark 0, then avoid air bubbles and frothing of the blood. Fix the tube vertically in a stand without disturbing for 1 hour. At the end of 1 hour, read the height of clear plasma above the upper limit of column of sedimenting cells to the nearest millimeter. So this indicates ESR. So ESR, erythrocyte sedimentation, has a prognostic value and it does not have diagnostic value. Certain factors definitely influence erythrocyte sedimentation, and they are Role formation, fibrinogen and globulin content, the number of RBCs, size and shape of the RBCs. So more the Role formation, more the sedimentation and more the ESR. The fibrinogen content is going to increase the ESR, whereas globulin content is going to rather albumin content is going to decrease the ESR. It also depends on number of RBCs. More number of RBCs, less the ESR, and less number of RBC, more the ESR. And even size and shape of the RBC. If the biconcave shape is lost, the ESR is reduced. Then ESR has to be reported as the erythrocyte sedimentation of the given sample of the blood is so many millimeters at the end of first hour. The ESR is usually measured by Winthrop's and Westergreen method, and ESR is different in male and female. With the Winthrop's method, uh, in males ESR is 0 to 9 millimeters at the end of first hour. In females it is 0 to 20. With the Westergreen's method, in males it is 3 to 5 millimeters at the end of first hour, and in females it is 5 to 12 millimeter. So there can be physiological variation. During pregnancy, the ESR increases due to the increase in the plasma fibrinogen content. And during menstrual bleeding, the ESR is more in menstrual phase. The ESR is more during parturition as well. When compared in gender, ESR is more in case of females. And as the age decreases, the ESR is high, as it is seen in newborn and infant. Some pathological variation where the ESR is increased is chronic disease like tuberculosis, acute infections like cellulitis, chronic inflammations like arthritis, malignancies. In all the types of anemias except the membrane abnormalities like hereditary spherocytosis and sickle cell disease, the ESR is increased. And other diseases like collagen diseases like systematic lupus erythematosus and chronic infections like tonsillitis. The ESR can be decreased in case of polycythemia. It is reduced in sickle cell anemia, hypofibrinogenemia, hereditary spherocytosis, and hyperviscosity syndrome. So this is in brief about the erythrocyte sedimentation rate